Hi there. So today we're going to talk about a birth plan. I can't really see that, but I've got a little plan here called a birth preference plan. And you can get one of these free in my bio. You just click the link and you'll see a link that says free birth plan. And you can download it. You'll get one that is filled out where you just kind of circle yes, no, or answer questions. And we also have a blank one that you can fill out specifics for you. So a birth plan. I'm sure that you've heard that some labor nurses get a little bit rude about birth plans, and it does happen, but that's okay. You can still bring a birth plan, and a birth plan is great, and I'll tell you why. Not so much because you have it and you can hand it to them. The real power behind the birth plan is that you are educating yourself ahead of time and educating yourself enough to know the choices that you want to make. Education is key to having an empowered birth. Key. I am not kidding. You need to be soaking up the books. You need to be taking classes, whether it's online or live. Either way, you need to educate yourself because, mama, education is power in all areas of life, but especially in birth. So your birth plan. Once you're educated and you know the things that you prefer, because it's not about what everyone else is saying you should do. It's not about your family who says you have to get an epidural or your family who says you better go natural. It's about what you want in your birth. That's what a birth plan is. And you can only make those choices if you know what choices there are to be made. You know that saying, like, you only know what you know and you don't know what you don't know. So you need to learn as much as you can so that you can make smart choices when it comes to birth, and so that you're not coerced into doing things that you don't want to do. So our birth preference, which we created on Habibi House, it has a little section that says about me, and in there you're going to want to write what name you prefer to be called, your blood type, your due date, all these things that you're going to that's important when you get to labor and delivery. If you're huffing and puffing and you don't want to talk, you can hand this right to your nurse. She sees your name and your due date, and those are two really important things that we need to know right off the bat. As far as your blood type, if you don't know it, ask at your next prenatal visit and they can tell you what your blood type is. There's also a section for my support tribe. Support's so important, especially if you're going natural, but it's also important if you get an epidural. You still want to have support. It's just something about having a team around you during birth is just vital, critical to a pleasant birth. There's a section about pain. You can make decisions on whether you want to be asked the pain scale. When I have a natural patient, and when I was a natural patient myself, I preferred not to be asked the pain scale. I mean, I'm huffing, puffing, breathing, trying to keep my mind focused, which natural labor is a lot in your head. And how do you keep that headspace if someone is constantly saying, on a scale of 1 to 10, how would you rate your pain? 10 being the worst pain you've ever felt, and my favorite, which is what I say, 10 being the worst pain you've ever felt, like getting your leg cut off without anesthesia, and 5 being like the worst period cramp you've ever felt. Now, who wants to sit there and focus on that? Nobody. So you can tell your nurse, I do not want to be asked the pain scale, because we, as professionals, we have to chart that we are addressing your pain every hour. Labor, how you want to labor, what positions you want to assume, if you want to be on the monitor. These are all things. If you want to wear your own labor gown, which right now my shop is closed, but I do have a shop and we sell the most incredibly delicious labor gowns you've ever seen. And what are the most important things to you during your labor? If you want to ambulate or walk during labor, and a lot of these things you really have to talk over with your physician as well, because if your physician supports you, it makes your life so much easier. If you want to have student doctors or nurses in your labor room, because you have a choice. So if your nursing team or your OB comes in and brings in students and does not ask you, you have a right to say, I do not prefer to have students in my labor room. This is your labor room, mama. your baby, what feeding preferences, if you want to start the vaccinations in the hospital, eye ointment, skin to skin, so important. I'm going to do a video on that later on about skin to skin. And if you want to delay the bath, if you want all of the baby's assessments done right on top of you, which can be done. The ambiance in your room. These are all things you want to address in your birth plan. But again, you cannot create an efficient birth plan that reflects who you are unless you know the choices that you have. And you have a lot. So make sure you learn them. Have a great day.